Diagnosis came as a shock, as I'm sure it does to most people. 11 years ago now, so I was 23 back in 2006. Hit me as a thunderbolt, being diagnosed, as I'm sure it does to most people. And from diagnosis, I was told I had a serious blood disorder. I was then told that that was leukemia, and I was then told that that was cancer. That was like taking 3 bullets in one. I wasn't sure either one of those were related to each other. So I was immediately set on a path of treatment out of the blue, which basically for the next 6 months I got transported into Worcester Hospital. So I'm from Bromsgrove near Birmingham. So Worcester is where I went for my chemotherapy. Was fortunate enough to get through that. And got into a remission, and then they put me forward to have a bone marrow transplant in Germany, where as a result of a German guy who signed up for the register over in Hanover, he effectively saved my life. So I underwent a bone marrow transplant in July 2007 in Birmingham, and yeah, gone from luckily from strength to strength since. The treatment. How did the treatment impact my life? I think I've been very fortunate in terms of long-lasting side effects. Have been very minimal. I think more psychologically than anything. I think it changed my perception on things. I realised quite soon into my treatment, and certainly when I was starting to embark on my recovery, that I wanted to do something to make a difference. I wanted to chase what I felt was missing when I was diagnosed with the disease, which was someone I could talk to who'd been through the exact same thing I had. I think that's the same if you're training to do the London Marathon, you want to speak to people who've done it. If you're embarking on anything that's new, I think it's always good to see people who've come through it and who've gone through the same thing. So the big difference for me was that I realised I wanted to, whatever I do for the rest of my life, I wanted to make sure I was always trying to help others who were in need and in the position I was. I think that's the most significant change. Side effects physically, no ailments as such. You know, I think I'm I think I'm very lucky in that respect. I had highly intensive radiotherapy and things. I think my ability to do mental arithmetic and things has probably lessened, but I don't know if I'm blaming the treatment for that or whether I'm just less used to using that as I got a bit older. But no, all in all, I'm very lucky, I think. The advice I would give is, I mean, it's too easy to just say stay positive, because all your family and friends say that. I think the best advice is to be how you need to be. If you need to cry, just cry. If you need to laugh, you just laugh. The thing about an illness like this is it's taken out of your hands. You're on a conveyor belt of treatment where these doctors, nurses all come in prodding you. You have a meeting after meeting. Something has to keep you sane. I was blessed to have a good network of family and friends around me. That's really important. Not everyone has that, but I think trying to remain positive. Realise there may be some bumps along the way, because this illness does do that. A lot of blood cancers do that. But where you can, I would be as open as you can. Talk to people, use the resources to hand, talk to the various charities that are on hand to help you, and where you can, maybe engage with other people who've gone through it to help make yourself feel better and to put those fears that you may have to rest. I think it's a fantastic conference and event. It's in a great place. The absolute plethora of different people here talking. I mean, I was giving a talk just earlier, talking about my story effectively, but I'm blinded by science from some of these people. Now, when you're embarking on treatment from a patient point of view, your life's in the hands of these experts. These experts are here today. My most impressive thing, or the thing that's impressed me most, is that all these experts have come up to me and started thanking me and started saying it's so important to hear from the patient. That's so reassuring when you're a patient, to know that these experts actually have that human side to them and that they can resonate with the patients, because we are their project. You know, I remember my dad describing that when I was scared out of my wits with the illness. He said, but you're a project for these people, you are their work. And I think you're seen as that. But today showed me that they look beyond that as well, and they see you as people, and I think that's been really quite enlightening for me. And I'm generally just inspired by the wealth of intellect in the room, not just speaking about myself, but all the scientists that are probably a massive part of the reason I'm still here.